Let's bring gold standard CBT back into the room. Why does this specific cocktail of traits clash so hard with traditional therapy?
It comes down to the mechanism of change. How does CBT actually cure anxiety? Usually it's through something called habituation.
Habituation is basically just getting used to something, right? You do it over and over until it gets boring.
That is the clinical goal, boredom. The theory is that avoidance feeds anxiety. So we do exposure therapy. We make you face the scary thing, the loud party, the conflict, the crowded subway ride, and we make you stay in that situation until your anxiety naturally
The
drops.
idea is that your brain eventually realizes, hey, I didn't die. This isn't actually a threat. And the internal alarm bells finally turn off.
Right, but here is the major problem. For an HSP, pushing through high stimulation often doesn't lead to boredom, it leads to flooding.
Flooding, that sounds pretty catastrophic for the nervous system.
It is. The nervous system gets so overwhelmed by the sheer volume of sensory input that it stops processing entirely. The person might dissociate, go numb, check out, or have a full-blown panic attack. The anxiety doesn't drop. It spikes and it stays there.
So the brain never learns that this is safe. It just learns that this is torture.
It is actually sensitizing them, which is the opposite of the goal. It's re-traumatizing. You force an HSP to stay in a situation that is biologically assaulting their senses, like a chaotic, loud office or a crowded bar. You aren't building resilience. You are just proving to them that the world is indeed dangerous and painful.
And on top of that, you have the issue of validation. Standard CBT focuses really heavily on cognitive distortions.
Right, concepts like catastrophizing or all or nothing thinking. The therapist's job is to challenge your thoughts. They might ask, is the sound really that loud, or are you just focusing on it too much?
But for the HS,
For the HSP, the sound is actually that loud. Their biological reality is fundamentally different. Their hearing might literally be more acute. If a therapist tells an HSP that their perception of pain or overwhelm is a cognitive distortion that needs to be fixed, that is incredibly invalidating.
it's basically gaslighting them about their own body signals.
It teaches them to fundamentally distrust their own senses. They start thinking, my body says this is too much, but the doctor says that's a distortion, so I must just be crazy. That creates a really deep, lingering sense of shame.